with Sarah. Now, Sarah suffered a stroke 5 years ago and you're worried about, I guess, ill health in the future. What's your question for Dr. Hilary, Sarah?
Good morning, Lorraine. Good morning, Dr. Hilary. My question is, I want to know whether I could possibly be suffering from lupus, and then maybe that might have the answer to all my questions.
OK, Sarah, good picture, isn't it?
Yeah.
Sarah, tell me, why do you think you might have lupus?
Well, I had my stroke nearly 5 years ago, 5 years in November, whoop, and I'm still alive. They say I've got a blood disorder. They're not sure why I suffered my stroke. Since then, I've had lots of blood issues. I'm constantly anemic. My immune system is not very good. I suffer terribly with itching of skin, which I've been told is part of being anemic. And somebody suggested to me, a lupus sufferer, that maybe I might suffer from lupus. And maybe if that is it, it might have the answer to why I'm constantly suffering with various infections and everything else.
Sure. OK, Sarah. Well, look, I mean, I can understand your question. I think, first of all, you need a diagnosis. It's difficult to diagnose lupus. Lupus is an autoimmune condition. It's not that common, probably only about 15,000 people in England and Wales. Much more common in women than men, though. So you can either get skin problems on their own, in which it's discoid lupus, or you can get systemic lupus, which is internal organs as well, joints. Have you got any joint problems? Anything of that nature? OK. So you can have some blood tests done, which may not be confirmatory in the first instance, but if you get a flare-up, which often happens, those blood tests are usually pretty positive. So things like anti-nuclear antibody, anti-DNA antibody, these become positive when you get these flare-ups. And whilst you can get false positives of some of those blood tests in people who haven't got lupus, they're a very good indication with the clinical symptoms of what you do have. If you do have it, it might explain why you had a stroke, because you can get associations with internal organ problems with lupus. But get the blood test done first, and then there's treatments like hydroxychloroquine, steroids, immunosuppressants, which will keep things damped down.
Sure.
So, and nowadays the outlook is much better than it used to be. So normal life expectancy, however bad it is usually, so don't worry about that, but go and get those tests done.
Absolutely.
Thank you.
Absolutely. Thank you very much indeed, Sarah. Thank you.